Okay, hi, my name is Bruno Bockorny. I'm a GI oncologist practicing here in Boston. I work at Beth Deaconess Medical Center and Dana-Farber Cancer Institute. So at AACR, I will present the preliminary result of the phase 1 first-in-human study with this anti-CCR8 antibody called Denikitug in patients with advanced solid tumors. So the rationale for this study is this. Regulatory T cells or Tregs, they are major drivers of immunosuppression within the tumor microenvironment. And their accumulation in the tumor is actually associated with worse outcomes across multiple tumor types. So we have this drug called Denikitug, which is an engineered monoclonal antibody specifically designed to target these CCR8 positive intratumoral Tregs. And this antibody was designed in a way to go after the intratumoral Tregs only, and not so much on the peripheral Tregs, minimizing adverse events. The phase 1 was a large study with two major components. One to evaluate Denikitug as a monotherapy, and the other, Denikitug combined with an anti-PD-1 inhibitor. For AACR, we'll be presenting the data of the monotherapy cohorts, part A and part B. There was a dose escalation initially, and then a subsequent cohort where patients received doses of 10 milligrams and above. And we were also able to obtain pair biopsies to understand the immunobiological effects that Denikitug was causing the tumor microenvironment. Moving to safety, overall, the safety profile of Denikitug was manageable. The main adverse events that we saw were immune-mediated skin rash and pruritus, also some diarrhea, mainly grade 1 and 2. Grade 3 adverse events were uncommon. And overall, we think this profile is very consistent with the immunomodulatory mechanism of action of Treg depletion. Now turning to efficacy, it's important to point out this was a heavily pretreated population, and 2/3 of the patient had prior exposure to anti-PD-1 or anti-PD-L1 therapy. Within the 52 evaluable patients, we saw objective response rates of 8% and a disease control rate of 46%. I will note that responders had a median of 6 prior lines of therapy, so heavily pretreated patients, and the responses were also durable. The median duration of response was 4.3 months, but ranging up to 14 months. And in terms of the immunobiological effect, we were excited to see that the drug was doing exactly what it was designed to do. After 2 doses of Denikitug, we saw actually a major depletion of the intratumoral Tregs and a concurrent increase in expansion and infiltration by CD8 positive effector T cells.